I want to make sure also that we don't have, let me say that again, we don't have visceral fat. And I know everybody has heard that term. And what does that mean? What's visceral fat? So, this is fat that normally kind of resides around the organs inside the abdominal cavity. Tummy tuck does nothing for anything inside the abdominal cavity. And let me bring this up so I can better illustrate what visceral fat would look like. This is a cartoon diagram. As you can see, tummy tuck would treat the subcutaneous fat or fat beneath the skin, and it would treat the weakened or rounded abdominal muscles. If you have fat behind that at muscular wall around your organs, there's nothing that I can do. There's nothing that any plastic surgeon or any cosmetic surgeon can do about that. That's all you. That's all you. And how you do that is you get in a calorie deficit, you exercise, you burn, and you bring that down. So I'm really diligent about, looking for that or trying to get a good sense if we have that or not. Because if we do a tummy tuck on this client, they're going to have a tightened muscle, less fat, tightened skin, but it's still going to look round from the side. Nobody wants that. No man, no woman. For men, it's a little bit different. They have the visceral fat, which is commonly called a beer belly. That fat, again, has to have the same type of treatment. You got to get in a calorie deficit. You got to exercise. You got to kind of burn and bring it down. That will help your abdomen. And because tummy tuck's a rarity or less likely in a man, even though you can have it, then you can focus on the areas that you probably really are concerned with, which would be your love handles. And sometimes they don't burn as efficiently as the visceral or beer belly that you have if you just get in a calorie deficit. So then that's where I step in and I can liposuction your waist and we're good. So either men or women, we need to make sure that we can identify visceral fat because that will affect the outcome. And we need to basically take care of that before we move forward with any type of aesthetic procedure.